I am Nikhil Bhaskar. I'm a managing director and partner with BCG. I do a lot of my work at the intersection of healthcare and technology, and I've had many years of experience working with large healthcare companies and supporting them in end-to-end transformation. I think what we are seeing across the system is a conundrum of 75, so to say. There are 75% of the healthcare companies that we work with are actually implementing GenAI. They're piloting it, they're trying it out. Some of them are thinking about it, are wary. But what we definitely see is that 75% of these companies are actually not seeing direct results from GenAI. It is still a pilot, it is still a shiny object, and it hasn't led to actual business impact flowing through. Our biggest takeaway on this is that GenAI still exists as a series of pilots that companies are trying and testing without actually changing the underlying technology behind it. So it is a shiny object that gets bolted on as something to do versus rethinking how your business actually happens. In our view, GenAI is actually, when we think about it, is three big things. Number one is you think about AI to expand productivity, improve basic business processes. The second level is where you think about GenAI to fundamentally reimagine functions of how work happens in a particular function, whether it's marketing, whether it's clinical development, whether it is finance as a support function. And then the third level is you think about AI more fundamentally as reinventing and reimagining your business. So those are three levels, and we see that most companies right now are still at a thinking of GenAI more as a tool to try to unlock employee productivity and less as an instrument of transforming and reinventing businesses and reinventing their own functions. I think historically, if you think about how health systems and more generally healthcare companies have evolved, is today patient data, health data gets locked in silos of individual functions and best of breed point solutions. That is, I think, fundamentally the biggest roadblock in creating healthcare impact and improving clinical outcomes. I think some of the implementation, the way it's being done, is being thinking about AI more as a tool, which is resulting in even further accentuation of these data silos. And you're seeing a proliferation of applications and new tools that are cool, that are something which are shiny objects that enterprises are adopting, but not something that is changing the underlying plumbing of how data moves across health systems. So what we think is what is needed is a unified platform that breaks these data silos and unlocks the power that is in healthcare data. So if you think about this more holistically versus taking a functional view of it or a single enterprise view of it, we see that it can lead to significant productivity unlock. And AI presents that opportunity to now reimagine how data plumbing is created and how those silos operate. I think number one is, what is the lens that you wear when you think about AI? Is it a technology first lens or is it a business first lens? Companies where we have seen GenAI actually make a profound, tangible impact is where this has been led at an enterprise level with a business-driven AI strategy versus it being a technology first solution and you think of it just as a tool. That is one of our biggest insights. Second insight is that a large part of the effort has to be in changing ways of working, changing how functions collaborate with each other, of how underlying processes are designed and ways of working, augmenting the technology versus thinking of technology as a shiny object that's bolted on to fundamentally broken processes. It's like putting icing on a cow dung and saying it's a brownie, right? The icing fundamentally will not change underlying processes that are broken. I think we're seeing fundamentally on three places impact showing up when companies and enterprises have implemented AI effectively. Of course, this is still at pilot stages. Many companies haven't been able to scale it at. Number one is quality. Number two is capacity. And number three is cost. Across these three dimensions, we have seen a significant jump when AI has been implemented effectively. What we see is on quality, there is a 2x improvement in how clinical interactions are taking place because physicians have a lot more time that's available to them and are not actually, that time is not being spent in administrative tasks but actually with the patients. On cost, what we are seeing is a lot of places, this whole concept of a digital twin being created, of an employee agentic twin being created, where anywhere you would expect 20 to 50% productivity improvement in transactional activities to begin with, and then more analytical abilities to add to it. And then just what that results in is much higher capacity being available for health systems to provide care. I think healthcare is different. Healthcare data is unique. And the way, if you historically think about it, we started in the 90s with implementation of the first set of LIMS tools, the HMIS tools. Many enterprises are continuing to carry these legacy systems year on year. What you need is a custom application that can actually understand the intricacies and nuances of these health data systems, this data plumbing, to unify data that's locked in silos of applications and silos of legacy systems. A simple out-of-the-box solution that is industry agnostic, our view is going to be very difficult to implement and scale. You might be able to successfully pilot it, but to be able to scale and get an enterprise impact on quality, on cost to serve, and on capacity is going to be definitely challenging. That's a good question. I think right now, our view on this is GenAI is not going to wait. The learning curve on this is steep, and it is natural to get overwhelmed with a lot of the noise that surrounds AI. But unlike some of the other, and what we have often seen is every new technology launch is bundled with a lot of hype around it. Our view is that the companies that have been able to do this extremely well are ones that are thinking of it at an enterprise level and not just throwing it at data scientists further down in the organization to think of it as a data or a technology problem, but as a business reinvention problem. It comes back to that whole thesis of how do you think about AI not as a tool, but as an opportunity to reimagine how work happens in a function and how companies' business model is designed. And what we see is AI fundamentally creating disruptions overall in the value chain and creation of new value chain land dollars.